clearly it's a tough issue for the states, when and how to safely reopen this morning. We're joined by Maryland Governor Larry Hogan, who just laid out what it is going to take to get his state up and running again. Governor Hogan, thanks so much for your time this morning. And again, reopening top of mind for folks all over this country. As I understand it, you're not ready to do it just yet there in Maryland. In fact, yesterday you laid out the 4 steps that you think you should take there to get the state reopened. What are those steps?
Well, so in Maryland, here in the Washington-Baltimore corridor, we're just really still heading up that curve. We're about a couple of weeks behind some of the hot spots that you were just talking about. So it'd really be the worst possible time for us to try to put more people out there and endanger them. But we have been meeting and talking with experts for several weeks now about what it would look like to try to get back to some type of normalcy. I've also, I'm leading the National Governors Association. We have a call this afternoon with the president, the vice president, their team to talk about what kinds of recommendations the federal government's going to make. And we've been meeting with all of the nation's governors. We've had, I think, 14 different conference calls and talking about what's going on in different places in the country. But what all of us are going to need before we can try to get people back to work is more testing, more ability to do contact tracing. We're going to have to make sure that we have the hospital capabilities and all the PPEs. And really, those are the kind of 4 building blocks. Everybody wants to get our economy back and get people back to work and get our small businesses open. But we also want to make sure we do it in a safe way, and we're not just ramping things back up and endangering the lives of thousands of people.
Governor, to your point,
it's a terrible twin crisis that's going on at the same time. To
your point on testing, though, as you know, at last check, roughly 3 million people in this country have been tested. That's less than 1% of the total population. How are you going to ramp up testing there in Maryland?
Right. So in the past 3 weeks, we've increased testing by 5,000% in Maryland. It's not where it needs to be. Our goal is to be doing 10,000 tests per day, and we believe we're going to get there in the next several weeks. But and there's no question this has been the number one stumbling block in America, the lack of availability of testing, and you really can't get to any point where you can reopen the country until, not just in my state, but across the country, we can do much, much larger scale testing of more people.
You issued a mandate yesterday that would require folks to wear those face coverings when riding public transit, when they're out in stores as well. What prompted those stricter measures?
Well, so we, our numbers have been rapidly rising, and we had our 2 deadliest days in a row with sadly, the most deaths in our state. It's growing throughout our region. We're sort of the next wave of hotspots. And we just believe that one of the places where we have a weakness, we have to keep the stores open. People have to eat. They have to go to pharmacies, and they have to go to grocery stores. But when they do, they actually are endangering themselves and their families and their neighbors. And this is one really important step to keep their faces covered. It doesn't have to be a surgical mask, an N95 mask, just anything, a cloth covering over your face really goes a long way. And a couple of our most highly populated local jurisdictions made that decision already. We decided it was a smart move to do for the entire state.
I know that the confirmed cases there in Maryland, I believe, north of 10,000 now, especially hard hit Montgomery County, Prince George's County. Governor, you pointed out you're the head of the Governors Association. You're a Republican governor. There seems to be a bit of a tension between the administration and some governors over how to get this country reopened, how to get folks back to work. On this call that you're going to have this afternoon with the president and vice president, what are you going to say to the president and vice president about precisely how we should be doing that, and maybe just as importantly, how we shouldn't be doing it?
Well, yeah, I think there was a little bit of tension over the past couple of days between the president and the administration and some of my colleagues, the governors across the state, frankly, on both sides of the aisle. But the president, I believe, walked back many of his earlier comments from, he was saying that he had the ultimate authority and that he was going to tell the governors what to do. Later that same day, he said that they were going to make recommendations and guidelines at the federal level and that governors were going to make their own decisions in their own states, in their own time frames, based on the decisions on the ground that they saw fit to make. And I think that's actually the correct way to go about it. I think today they're going to talk about some guidelines that I think are helpful. It's great to have a federal partner, that there's many things the federal government can do to help the states. We believe they may come up with some good information that we can all share. But ultimately, it is going to be the governors that have to make these decisions in their own states. Different states are at different points in the curve. Yeah. Only we know what's going on in our states. And so I think we're going to try to have a productive dialogue today. And I'm not sure exactly what their announcements are going to be, but from the governors, we're going to say we want to work in partnership. We all have a role to play, and let's work together to save people's lives and get our economy back to work in a safe way.
Maryland Governor Larry Hogan. Governor Hogan, thank you. Thanks for your time, sir. Good luck to you, okay?
Thank you, Craig.